What are the group of patients you see in your day-to-day
In
practice?
urological practice, urology is a good mix of medicine and surgical diseases. Commonly, I see urinary tract infections. Any age group patients are susceptible to urinary tract infection, right from infancy to 70s and 80s of our age. There is some change in men and women. So, in early life, usually females are having more tendency to infections, and later on beyond 50, usually men are having more tendency towards infection. Above 65, 70, both are equally susceptible to urinary tract infection. Unless you have an understanding how the urinary tract infection happens, how we can prevent it, and how we can treat it, not all the time it is easy. Sometimes it is very nagging. Recurrent infections happens more than 3 times in a year. We call it recurrent infections. And any infection with fever, we call it complicated infection. Usually with fever means it is infection to the kidneys. Normally we get infection to our urethra and the bladder. We call it cystitis. Their symptoms will be like you will feel like passing urine more frequently. Usually we call if it is less than 2 hours, you have to rush to the toilet. You cannot postpone your voiding, urgency to void, painful voiding, blood in the urine, or discomfort throughout while you pee are major symptoms for urinary infection. Sometimes in elderly people I see they're just unwell. They cannot say why they are unwell. When we actually test them, we find urinary tract infections. Their sodiums are low, and they usually feel that I'm not doing well and not able to eat properly. Sometimes febrile, sometimes afebrile. Those are the cases we suspect strongly that they might be having urinary tract infections. Normally, a classic triad is pain in the flank, fever. Fever usually comes with body shaking like rigors and chills, high grade temperature, along with discomfort in passing urine, are classic triad of symptoms. And why it happens? Normally, when we culture them, we usually find the bacteria to grow are Escherichia coli, E. coli we call, Pseudomonas, Klebsiella, Acinetobacter. These are the bacteria which commonly we harbor in our body, mostly in anal canal area. And whenever our immunity is low, we get those infections. Anatomically, females are more susceptible because the urethral length is short. In female, it is 4 to 5 centimeter. In men, it is 25 centimeter, and very close proximity to vagina and anal canal. So they have higher chances of infection, especially when women are sexually active in that age group, more than 25 to 40 age group. You get sexually transmitted disease also. Sometimes if bowel is not all right, like people who are constipated or who are having diarrhea. The commonest symptom in infancy is diarrhea, not urinary tract discomfort. Children who are having diarrhea, UTI symptom is diarrhea. So diarrhea is a common symptom in infants, and sometimes constipation, alternate bowel habit, or diarrhea actually the source of infection. Then you get UTI tract infections. The commonest thing in our society, women feels that if I go to a dirty toilet, then you get the infection. It is actually a paradox again. Usually we believe that toilet is dirty, that's why we got the infection. But I feel it is different. It is because we think in a public area or in train taking a flight, you feel that public toilet is dirty and I am postponing my voiding. And while postponing my voiding, I actually try to over distend my bladder. And in a over distended bladder, when you go and empty, bladder cannot empty to the fullest. Usually we have a residue. The moment we have a residual urine in our bladder, we are likely to get infection. I usually advise, however dirty is the toilet, this bacteria won't jump into you. So usually you should empty. Excreta of our body, urine is excreta of our body. That has to be removed. If it stays with us, then the chances of infections are high. We have seen the children, some of the adults also coming into urinary tract infections. We call dysfunctional elimination syndrome. They also associated with constipation. Elimination of either it is stool or urine, both they have trouble. So there are different ranges of that, and sometimes we need to diagnose it more carefully. Sometimes we diagnose with the power of exclusion. Sometimes we do even pressure flow studies to look at the bladder functions. If bladder functions are not all right and people are constipated, we look at whether any neurogenic deficits are there, why the bladder is not emptying properly. So there are many stages of diagnosing urinary tract infection. The major concern with us is actually why it is not settling. Some of the people, like women also, we see the urethra and the lining of the urinary tract are more susceptible to infection, and once it gets the infection, they colonize the lining. Typical pili in E. coli, they get attached to that transitional cell lining and they don't get eliminated. When we give antibiotic, keep them on antibiotic, those severity can be low. The moment the antibiotics withdraw, they again become in a severe form. You get a recurrent infection, your kidney gets scarred. We call it Big Bang theory. In the children, the first infection causes major damage to the kidney and you can have a scarring in the kidney. Usually, if any men having a febrile UTI, we evaluate completely to the upper tract also. We approach our top-down approach we call. We look at first kidneys with ultrasound and sometimes isotope scans to look at the scars in the kidney. If there is a scar in the kidney, we try to look at why this scar happens. Sometimes they have a disease called reflux ureter, that is called vesical urinary reflux. If there is a reflux, urine which is infected will go to the kidney and infect the parenchyma of the kidney. You get infection and then it scars the kidney, which in long term is not good to happen because your kidney function can actually compromise. So we look at whether that can be treated with prophylactic long term antibiotic or sometimes some surgical procedures are also done to prevent uretrovesical reflux. Though it can be very simple problem, but it can lead to very serious illness. So usually we suggest if it has happened one time and you got treated and you are fine, that is no problem. But you are getting it again, then definitely we need to look at why you are getting it, whether it's inadequate treatment or atypical infection or there is more to that. Sometimes we see very atypical infections like chlamydia, gonorrhea, some of the viruses also we can see. Those who are sexually active, we see this type of infections. Those are very difficult to treat. Sometimes it stays there with you and have more serious complications out of it. In women who are postmenopausal, the environment, the milieu in the introitus area, vagina area changes because of estrogen deficiency. The lining of the vagina dries up. Subsequently, the lining of the urethra and that can be drying up. So we call it urethral stenosis. And emptying of bladder would be difficult, and they are more susceptible to infections. Once they have an infection, it actually very recurrent and can be notorious. So sometimes we put them on estrogen cream, local application, and low dose antibiotic for long term use. If they get febrile UTI, very commonly we need to eradicate with IV intravenous antibiotic. And usually I suggest to empty bladder more frequently, avoid any food which gives to constipation. If you are getting constipation, use laxatives or isabgol husk to avoid constipation. Sometimes our personal habits also need to be looked at. If you clean back to front, then you can actually contaminate your introitus area or vagina area along with the stool. So usually any tissue you use or cleaning you do, it should be front to back. So if you do it front to back, the infection chances are less. And sometimes the methods of contraceptives also predisposes to more of infections. Any chemical we use to the perineal area or vagina, we should not use any Hertz chemical or pH which is not suitable to our body. They kill the normal bacteria which is supposed to be there. If we kill the normal bacteria, then abnormal bacteria take charge and we get infection very commonly. So those things has to be used with the proper advice of the doctor. Otherwise, you can get into more and more trouble. When you self-assess yourself, if you have been to a medical doctor or any practitioner, general practitioner or physician, in spite of that, you are not getting relief or you are getting a febrile UTI with fever or hematuria, blood in urine, or it is coming again and again, recurrent. So those are the cases, probably better to see a urologist who can give you a better solution or look into why it is happening to you. Especially those who are diabetic and immune compromised, they should be more careful and take expert advice. I would suggest must go to a urologist.